Hi there. It's that time of year again when folks are asking me, how much is my Medicare going to cost for next year? So for 2022, just to give you an idea, most people are going to pay $158.50 for their Medicare Part B premium. That's a $10 a month increase over what they were paying in 2021. So typically that's taken out of your Social Security check each month. And if you're not receiving Social Security, you can plan on getting a quarterly bill in the amount of $158.50 times 3, because that's how much you would pay per quarter. And you can pay Social Security that way if you'd like to. If you're a higher income earner, you may be subject to IRMA. That's Income Related Monthly Adjustment Amount. And what that means is if you're making a higher income, what Social Security deems a higher income, then you may be paying more for your Medicare. If you would like to know exactly how much you would be paying if you do fall into that category, check out our Facebook page. We have that posted on there so you can take a look at it and see what category you would fall into if that's the case. Your annual Part B deductible for next year is going from $203 up to $217. So if depending on how you get your coverage, you may not be subject to that Part B premium. That Part B deductible. But if you are, that's how much it's going up, $14 more for next year. What about your Part D prescription costs? So Part D for drugs, okay, this is what your prescription cost or prescription plan is called, is Part D. These are insurance plans that cover prescriptions. And every year, Medicare sets the benchmark on how these plans cover your prescriptions. In other words, your prescription plan has to at least meet Medicare's benchmark. So Medicare says that you can have a deductible in your Medicare Part D plan up to $480 for next year. And not all plans will have that, so you'll want to check the way your coverage works, but just know that is the benchmark number that Medicare puts out there. So $480 deductible. Once your total prescription costs reach $4,430, you pay 25% of the cost of the prescriptions. So I know this can be frustrating for many folks, but believe it or not, this is an improvement. When I first started working in the Medicare space, if somebody hit the donut hole or the coverage gap, they had to pay 100% of the cost of their prescriptions. So we have improved that over the years. So if you reach the $4,430 total cost, you'll pay the 25% of the cost of your prescriptions, and about 4% of the folks on Medicare will reach what's called the catastrophic phase of prescription coverage. So after your yearly out-of-pocket drug costs reach $7,050, you reach the catastrophic phase for your prescriptions, and you'll pay 5% coinsurance or $3.95 for generics and $9.85 for other drugs. So whether you have a Medicare Advantage plan that includes prescription coverage or you have one of those standalone prescription plans, this benchmark coverage applies. I hope this has been helpful. Please be sure to check out our Facebook page. Reach out to our office if you have questions about your coverage. We're happy to help you. And I hope you have a great rest of your day.